This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, and on Facebook at TTT Live Online. We go now to the Manager of Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning, everyone. I am pleased to welcome you to another Ministry of Health virtual media conference where we provide the latest information on the Ministry's COVID-19 measures and all the work that we continue to do to safeguard the health of our nation. Today, we will have presentations from the Honorable Terence Dayal-Singh, Minister of Health, Dr. Roshan Parashram, Chief Medical Officer, and we welcome back Dr. Alana Kwamina-Best, County Medical Officer of Health for St. Andrew, St. David. I am Candice Alcantara, Manager of Corporate Communications at the Ministry of Health, your moderator for this morning's media conference. I now invite the Minister of Health to start us off this morning with his opening presentation.
Thank you very much, Candice. Good morning to the Chief Medical Officer, Dr. Roshan Parashram. Good morning to Dr. Best. Ladies and gentlemen of the media, and to the listening and viewing public. It is our pleasure to be here with you once again on Wednesday, 16th September, to continue the conversation about our personal responsibility as we move forward. The government of Trinidad and Tobago, from the start of this pandemic, laid out a roadmap as to how we can combat this virus. The roadmap was predicated on both government action, but also the issue of personal responsibility. We started closing the borders initially to China on January 30th. Then we added more countries until we had a total closure of the borders. We instituted, via regulations, public health orders, public health regulations, built around very simple measures that the public can assist us with, wearing of masks and so on. You know the drill. We don't want to go into too much detail. Then when we noticed that persons were not taking on some of the public health regulations as it applies to masks, we had to go to Parliament to amend the Parent Act so that regulations could be applied for the mandatory wearing of masks, which has been shown worldwide to significantly decrease the spread of COVID-19. We also took some actions, which we had to, from day one. And let me just remind the public, because every single business has a valid case. Every single person has a valid case as to why maybe these regulations should not apply to them. I just want to remind the public that daycares and nurseries have been closed from day one, and that impacts on their business, so they have a valid concern. Places of religion have been closed twice. They have a valid concern. Bars have been affected. Yes, they were closed at one time, but now they are on takeout only. And we understand that your business is not going to be what it was. And your concern is valid. Casinos, valid concern. Business as a whole has taken a hit. But we are doing this all in an effort to protect lives and livelihoods. We have to make an investment now in behavior change to have a better future. We have to make an investment now in the way we conduct our private lives and how we conduct our public lives. And that investment calls for behavior change modification. I want to congratulate this morning Father Charles Jason Gordon, who picked up the mantle, and I want to congratulate him as a leader of a religion, namely the Catholic faith, where in his homily yesterday, he made a direct appeal to the youth of Trinidad and Tobago. And the headline caption from the video clip that was sent to me by Father Jason Gordon, Archbishop of Port of Spain, speaking to the youth, is that restrain or restraint is the order of the day. He said it well. Restraint is what we have been asking for since day one. Voluntary restraint, and now that restraint is now in the force of law with the wearing of masks. Ladies and gentlemen, COVID will come to an end at some point in time. We just don't know when. But we have to invest in that brighter future. And the investment we are asking each and every individual to make is one of restraint. And I want to put up the graphic which I've been using very often just to show how lack of restraint could affect us all. How contagious is that disease? Yes, the majority of us are responsible, and I congratulate the majority of us. But it is that minority, that's shown by the person at the top of the pyramid, that one person who will affect 2, and then 2 will infect 6, and then you get exponential growth. So that one person on top of the pyramid who has a birthday party at home, who goes to underground fete, a Zessa fete, as the Commissioner of Police says. That is what we are asking for. In my words, and I put in, this is my interpretation of Father Jason Gordon's words, restraint. That one person at the top of the pyramid, that minority, we are asking for restraint. Because that is how you get in exponential growth. That is what will prevent us from achieving the country's strategic objective of moving from community spread back into cluster spread, which is where we want to go. The state will lead, but we are asking all citizens 100%, because the 99% compliance is not enough. It just takes that one individual going to a birthday party, going to a Zessa fete to capsize the thing. So the message this morning is a simple one. We empathize and sympathize with all citizens who are unduly affected by these restrictions. People have lost a year of education at university. People's businesses are affected. But if we don't invest in that better future now, ask yourself, what will be the effect a year from now if we don't make the investment now? So as Minister of Health, we continue to appeal to everyone who is tempted. And I know the temptation is there. Your concerns are valid. The temptation is there. But look at all the countries around the world now, and I don't want to call them out by name. You could go onto the BBC website, WHO website, CDC, CNN, and see all the countries that came out of lockdown, where economies were decimated, where people died by the tens, by the 20s, the 30s, the hundreds, the thousands. We have largely escaped that. The news is not all bad. But to continue on a trajectory where we want to move from community spread back to cluster spread, we are asking all stakeholders, and I want to congratulate Father Jason Gordon, and then the challenge has to go out now to other leaders in society, trade unionists, other religious leaders, leaders of NGOs, to join with us at the Ministry of Health, join with the words of Father Jason Gordon, restraint is the order of the day. If we can do that, we can continue to save more lives, have livelihoods to come back to. It is a balancing act between saving lives and saving livelihoods. So this morning, the message is to everyone, young persons included, because As I said clearly on Monday, not everyone is reckless, but it just takes one reckless person. Just takes one, as we saw in that pyramid there. We will get better, but we must sacrifice now for that brighter day ahead. So I commiserate with daycare centers who have been shut down from day one, places of religion, the bars, the casinos. I commiserate with them. But for you to have a brighter future, we must make this sacrifice now. The Chief Medical Officer will go through the clinical details. Dr. Alana Best will tell you what is happening in her neck of the woods. Because even in the midst of this global pandemic, there are still bright spots. Some of the statistics I could share with you as we worked them out this morning. Our percentage of the population that is positive is still only 0.24%. That is good news. It means 99.76% of the population is free of the virus now. That is good news. And what we are trying to do is to keep that rate as low as humanly possible. As low as humanly possible. But to do that, we need a partnership between the citizenry and the government in observing these simple measures. We are still seeing people in cars with 3 and 4 people with no masks, or the mask down by their chins. Don't wait to get charged. Don't wait for the heavy hand of the law to affect you financially, to get you to do these simple things. These simple things, doing the right simple things, have serious benefits to us in not spreading the virus. Because we don't want to go the way of other countries which oscillate between lockdown, free up, lockdown, free up. That breeds uncertainty. We want to be certain in our future. So Candace, those are my words this morning. The news is not all bad. Only 0.24% of our population affected. That means over 99% of our population is virus-free. So let us continue with the public health measures and invest now for a brighter day tomorrow. Thank you very much.
Thank you, Minister. And Dr. Parashram will provide us with the clinical update now and some information on the discharge criteria for those in isolation at home.
Hi, good morning. Thank you, Ms. Alcantara. Morning, Honorable Minister, Dr. Best, members of the media, members of the viewing and listening public. So I'll first go through the clinical update for this morning, Wednesday the 16th of September, which is as follows. The total number of tests done in the public sector so far, 27,883. The total number of unique patient tests completed, 24,820. Total number of samples repeated, 3,063. The number of tests that have been done in the private sector so far, 7,734. Total number of positives now stand at 3,293, with the active cases being 2,439. Our discharges are now 810, and our number of deaths are at 57. In terms of our hospitalized patients, we have 96 persons hospitalized at present, and they spread throughout a number of facilities, including the Kuva facility, where we have 60 individuals, the Kora facility, where we have 24, the Arima facility, we have 8 persons, and at the Augustus Long facility, we have 2 individuals. In terms of our step-down facilities, we have 6 persons at the UWI Davie Penal campus. We have UWI Canada Hall and UWI Freedom Hall being used for the majority of the police recruits who would have been positive, and those are 50 at the Canada Hall and 71 at the Freedom Hall site. In terms of our quarantine sites, we have 15 persons at the Chancellor Hotel, 41 at the Cascadia Hotel, 23 persons at the Home of Football, 25 persons at the Regent Star Hotel, and 77 persons at the Paria Suites, which give us a total of 181 persons being quarantined at this time from repatriation. If we could go to my first slide, please. So, We have been inundated by employers, to the most part, asking about letters to be released from quarantine over the last few weeks, and even patients wanting to be released. So there are two categories. In terms of our discharge, we have home quarantine. Quarantine are for persons that would have been exposed to the virus. They are not positive individuals. They are not patients that have symptoms. So basically, you would have received a form from the CMOH office that has a start date. For example, it would have been the 1st maybe of September. We ask that 14 days post that date. So if you're going with the 1st of September, for ease of reference, it means that on the 15th of September, you will now be free of that quarantine and you are able to go back to work or go back to other activities outside of your home once you remain without symptoms during that period. So that letter, that quarantine letter that was signed by the CMOH or their agent, would be what you would use to go back to work and what you would give to your employer as valid documentation that you have completed the period. You do not need a sick leave certificate, as you would not have been ill, and you don't need a fitness for duty. So the difference again, with quarantine, you are not a patient as positive. You are a person that would have been exposed to an individual that would have been suspected or confirmed COVID-19, and therefore you would have been asked to be in quarantine in the event that you converted to become a positive patient, so that we would not, as Minister would have showed the pyramid, we don't spread that disease to other individuals. So in terms of our second slide, if we could go to the second slide. So the second slide is our discharge criteria for isolation. So these are the persons, as of I think the 24th of August, that would have been allowed to stay home when you had a positive diagnosis of COVID-19. So for persons that have symptoms, there are two categories. The first one, the way we calculate how long it takes for the discharge of those individuals, a minimum of 10 days after the onset of symptoms. So from the date you first had symptoms, you count 10 days from that point. You add 3 days, meaning that you have no signs and symptoms for 3 additional days, plus you have an additional 7 days. That will give you a minimum period of 21 days in the first instance that someone can be, 20 days that someone can actually be asked to stay home for. If your symptoms last beyond 10 days, for instance, you have symptoms for, let us say, 14 days, we start with, instead of 10 at the beginning, we will start with 14. We add 3 to that, which will give us 17, and then we add the 7 days to that, which will give us a total of 24. So the number varies based on the actual symptoms that people have. For the majority of those at home, their symptoms would have been less than 10 days. So we are looking at about 20 days of being home before we let you back out to work. In this case, the CMOH offices will issue a form. For the period that you were ill, they would actually give you a sick leave certificate to cover that period, and they would give you a form, not a fit for duty, but a release from quarantine form, which is standard across all 8 counties and in Tobago as well, so that they can give to the employer that form, and meaning that you can return to work. In terms of, if you could go back to the slide for the last bit, please. The asymptomatic cases, meaning that you had no symptoms from the beginning. It has happened in cases where we have primary household contacts of positive cases, and after we swab those, they became positive. We are asking that they stay at home for 10 days from the date of at which the positive swab was taken, plus an additional 7 days. So in total, 17 days for asymptomatic people, and the same principle will take place because you are a positive case. You can be given a sick leave certificate to cover the period, and you can be given the document from the CMOH office, which will be given to the employer to go back out to work. So both things can apply in this isolation. Candice, thank you.
Thank you very much, CMO. And now Dr. Kwamana Best will give further insight into contact tracing and apprise us of some of the COVID-19 related developments in the St. Andrew, St. David area.
Good morning, Minister of Health, Chief Medical Officer, Ms. Alcantara, and a special good morning to members of the viewing and the listening public. Many thanks for inviting me to present today. My team and I cover the county of St. Andrew, St. David, which covers the Sandy Grande area and its environs, which means that our operations are embedded within the Eastern Regional Health Authority. I will be sharing on perspectives from our region, and the aim is to highlight some of the common pitfalls and the success scenarios that we have observed during our process of contact tracing, And I'm hoping that as you listen, you are able to glean some practical tips that will help you to safeguard yourself and your loved ones. We have 158 persons who have tested positive for COVID-19 between August 12th to present. And the process of tracing the contacts of these persons tells an interesting story. So let's start with a positive example. We had a positive case who always wore her mask while she was at work. She used a hand sanitizer frequently. And the day she became symptomatic, she promptly stayed at home. In that instance, none of her colleagues became positive. And I raise this as an example of the effectiveness of wearing masks, washing our hands, and watching our distance. Remember, we should be at least 1 arm's length away from each other. We have, however, seen other cases where persons continue to go to work although they felt unwell. In one organization, we've had 45 co-workers who had to be quarantined because of exposure to one positive case. As you would imagine, in the work scenario, you are comfortable with your colleagues, and so we may drop our guard. In this instance, there was no consistent wearing of masks, and persons were interacting with each other in very close proximity. As I mentioned, I cover the area of Sandy Grande and its environs. And certainly in that neck of the woods, the extended family plays an important role in everyday life. And there are pros and cons to this. In one scenario, we had an elderly gentleman who became unwell while at home. His family is large and very loving, but unfortunately 12 members of his family then went to visit him in that afternoon to see how he was doing. Because of that interaction, we would have then had an additional 2 or 3 persons who became positive when it could have been avoided. The arrival of COVID-19 means that we cannot continue with business as usual. Families need to start having discussions about who will be the designated caregiver should a member of the household become unwell. So, for example, you have a member of your household who develops, say, a fever, body pains, diarrhea. This person might need assistance while they're at home. The person who helps this sick person should not be somebody who is older than 60 or who has underlying chronic conditions like hypertension, diabetes, or asthma. In this way, if the sick person does in fact test positive for COVID-19, the more vulnerable persons within the household would also have been protected. So, as you have your family discussions, designated caregivers should be in good health and have no underlying health conditions. And just to remind everyone about the potential symptoms of COVID-19, these include fever, body pains, cough, runny nose, fatigue, vomiting, diarrhea, loss of taste, and loss of smell. If you are experiencing any of these symptoms, it is better to be cautious. Please stay at home. We have been aware through our contact tracing process that persons might have felt mildly unwell with a headache and a runny nose. And they still head out to work because there's a sense of duty. They feel they don't want to burden their colleagues. But unfortunately, days after, they then realize that they are COVID positive and have unnecessarily exposed their co-workers. We know that organizations have faced challenges around business continuity during this pandemic. While there are many challenges, COVID has in fact provided us with an opportunity to be our brother's keeper. One of the strategies that we have found to be useful within the Eastern RHA as an organization is to actually have daily check-ins with our members of staff. So within the ERHA, each supervisor has a check-in process with their team members, which might be a group of about 5 to 10 persons. So there might be a WhatsApp group And every morning, there's a checklist that the team members are expected to identify whether they have any symptoms, whether they may have been exposed to somebody who was COVID positive, or if they have forgotten to mention that they had been tested and are awaiting test results. In all of those scenarios, whether you have been exposed to someone, you're having symptoms, or you have had a swab and you're waiting the result, you should not be at work. These daily prompts help to highlight potentially ill employees and safeguard an organization's operations by reducing exposure of other staff members. So let's talk a bit about the household in which there is a known COVID positive person. Please remember, if you have a positive case at home, the entire household has to be quarantined, as you would be considered primary contacts of the positive case. And just to remind everyone what a contact is, it's a person who is within 1 arm's length of a positive person for more than 15 minutes, someone who has had direct physical contact with a positive person, and someone who shares a room, a meal, or other space with a confirmed patient. It is incredibly important that household members also remain at home. Even if you do not feel unwell, if there is an adult or a child in your household who has been diagnosed with COVID-19, then you too need to stay at home. I have said this several times now in different ways because it is crucially important. Remember, if you have this diagnosis, do not try to hide it from the other members of your household. We do want to break the potential transmission of this disease, and so it is important that everyone knows what the state of play is. We know that with an entire household being in quarantine, one of the concerns that can arise is access to food. There are 2 options. Family members who do not reside in the household can leave food items and other supplies, say for example at the gate, so that there's no direct contact with the members of the quarantined household. If, however, this is not possible, our friends at the Trinidad and Tobago Red Cross are willing to help in providing groceries. So if you are quarantined at home and you find yourself needing this assistance, please let the member of the surveillance team that calls you daily, please make them aware of this, and then the relevant CMOH will relay your information to the Red Cross. You do not need to contact the Red Cross directly. Let us consider what would happen if you are a COVID positive person and at home. If you are COVID positive, then you should minimize your movement around the house and in shared spaces. If you do have to go into shared spaces like the bathroom and kitchen, these areas should be well ventilated. Other members of the household should avoid entering the room that is occupied by the COVID positive patient. I also want to put a plug here for telephone use. So we have noticed in the daily calls that we may call a positive person, somebody answers the phone who's not the patient and then hands the phone over to the positive patient. That is not ideal because you are increasing your risk of contracting the virus. A medical mask should be worn as much as possible by the patient and changed daily and wherever it becomes wet or dirty from secretions. The COVID positive patient should use dedicated bed sheets, towels, and eating utensils. And these items should be cleaned with soap and water after use, and they can be used again. There is no need to throw them out. Clean the COVID positive person's clothes, bed sheets, and towels using regular laundry soap and water, or machine wash at 60 to 90 degrees Celsius with common household detergent and dry thoroughly. So with regards to contact tracing, there are persons who are quarantined and they tell you, no, I have not left my home, which is excellent. But we have faced scenarios where visitors come to the home. So just to remind everyone, there should be no visitors coming to the home where a household is under quarantine. We want to avoid unnecessary transmission of the virus. So no visitors should be allowed into the home until the person has completely recovered and they have been discharged by the surveillance team. In summary, we know that there are effective public health measures that can slow down the transmission of this virus. Across the country, our teams are working hard to identify, isolate, and test persons. We have contact tracers working 7 days a week, tracing and quarantining contacts. And I would like to take this opportunity. Certainly within the county of St. Andrew, St. David, we have nurses, doctors, medical lab technicians working very long hours in the effort to combat COVID, and I know that this is replicated in other jurisdictions in the country. I'd also like to say thank you very much to our friends at the Trinidad and Tobago Police Service who have been collaborating with us and assisting when necessary to remind persons of their responsibility to remain quarantined. We are doing our part. I ask that you, the members of the public, do your part too. Please, wear your mask, wash your hands, and watch your distance. Thank you.
And so thank you, Dr. Kwamina Best. And we move now into the question and answer segment. Media representatives, it's your turn to direct your questions to members of the panel. And we begin with questions from Guardian Media Limited.
Hi, good morning, everyone. Rashad Khan, Guardian Media Limited. All right, so I have two quick questions. First, CMO, I'm really glad you spoke about the discharge criteria because it's something that we've been getting calls about. Many persons who may have been discharged are complaining that their employers want and insist on seeing a negative PCR test before they are allowed to return to work. I'm just wondering, is the Ministry of Health going to do anything to kind of clarify this process for employers, especially in the private sector? Because sometimes they're even insisting that these patients go and pay out of pocket to get a private test done so that they can return to work. And now, Minister Diyal Singh, this morning I saw the parent, the father of the girl who was on the private beach, had a few choice words for you and officials about your statements on Monday, as well as the whole handling of the situation. Now, I don't know if he was hacked or anything, but would you care to comment on it?
Okay, so I'll take the second part first. So I have received some condemnation, but I have also received messages from many parents saying at last somebody had the strength to talk to young people. One parent said to me, Terry, because she knows me, she emailed me. She said her child, around 25 years of age, went to a party. Her mother died. It was subsequently found out that that 25-year-old person, as not in the case of what Dr. Best just spoke about, went to an underground party, got infected, brought the virus home, and in her words, killed her mother. I have had messages saying, at last somebody is willing to talk truth to power, to the minority. It's a minority of people. And I took an oath in office recently to conduct myself without fear, favor, malice, or ill will. I am not afraid as Minister of Health to talk the truth, because it is a continuous sweeping under the carpet of the responsibility of every person. You heard Dr. Best said, elderly person invited 12 people home. That is what we are talking about. One person goes to work, infects 45 people. So we keep saying it's a partnership. So I am not afraid of the backlash. I anticipated it. As a matter of fact, I thought it would have been worse. But I am comforted by the fact that the positive reports, parents calling me and saying, at last, somebody is willing to take the bull by the horns and talk to young persons. Richard, I will draw an analogy that somebody gave me. You know, when you're in traffic and you are doing the right thing all the time, and then people come on the shoulder, they say, at last somebody is willing to talk to those people who drive on the shoulder. That's the analogy somebody gave me, somebody much wiser than I am. So I am not afraid. I have no regrets, because we have to talk truth to power in this thing. Okay? So Richard, thank you very much for raising the issue, my friend.
Okay, in terms of your negative PCR, the reason I discussed it this morning is really for the employers as well as employees, to be fully aware of what are the criteria. We have put it on our website, so it's available on our website for everyone to view. We are asking employers, please abide by the guidelines that we have put out. These are WHO-based guidelines for discharge, and we really will reach out as well to the Trinidad and Tobago Chamber of Commerce. I have spoken to the Chief Personnel Officer about it, and he agrees fully as well. So I think we have the backing of the human resource persons as well. But for the minority of employers, we really ask you to go on the website, look at our guidelines, and really abide by them going forward.
Richard, let me just come back to your question. My discussion on Monday was because somebody put themselves out there. This was not a personal attack. Somebody chose to put themselves there, and I had to respond. But not everybody is reckless. But that reckless minority will endanger you, Richard. Newsday is saying they have to restructure because advertising revenue has gone down. Your livelihood, Richard, working in media is affected. Because if businesses don't open and there's no advertising revenue, who is going to pay your salary, Richard? So when I said on Monday, my livelihood is affected, Richard, we are all in this together, my brother. And the unfortunate actions of one person will mean we have to shut down businesses. If we shut down businesses, nobody's going to advertise with GML, and you don't have a job. We are all interlinked in this thing, Richard. I hope that gives some more clarity to the issue, my friend.
Thank you, Minister, for driving that point home. And we go now to AZP News.
Hi, good morning, Priya Bihari, AZP News. Minister, just wanted to follow up on two issues I had raised. The first one is Hazard public servants who may have left before the borders were closed, and they are still waiting to return home, and they're being told to apply for no pay leave. I don't know if you can shed some light on that. And the second issue is that why was horse racing allowed and other sports were banned during this recent
So, thank you very much for the questions and give me the opportunity to clarify. So on your first question, I suggest you pose that question to the Ministry of Finance. On the second question, we said, again, just to remind, horse racing was not considered a contact sport. What the regulation spoke to were contact sports where you have groups of people, 10s, 20s, teams, breathing in each other's faces, exchanging fluids and so on. So we thought that the risk of horse racing was not as high as the risk for football and cricket. And what we are trying to do prior is to keep as many sectors of the society as open to give a sense of normalcy. We are not being overly draconian, so the great race will come off, but under certain conditions. One, no congregation of crowds at the start line, the finish line. They have agreed to go to Tobago, win the race, and come right back to Trinidad. We are trying to strike the balance between risk and benefit. So we are not shutting down everything. We are not being as draconian as other countries. We are trying as far as humanly possible to keep as many sectors of the society that in our view pose a minimal risk to keep on going. So for example, I just signed off this morning on the conduct of examinations. 2 weeks ago, I signed off on 6 people to leave Tobago to come to Trinidad to write examinations. The risk was low and the benefit was great. It gave those people certainty. Many schools have written to me for exemptions for examinations because the regulations allow that, and I have not refused any. All exams are going on. We went ahead with SEA because we felt that the benefit far outweighed the risk. So we are not applying the heavy hand across the board. We treat with all of these things on an individual basis, measuring risk versus benefit. So I hope that answers your question, Prior. Thank you very much.
Thank you very much. We move now to Express newspaper, please.
Hi, good morning. Camille Hunt, Express. Minister or CMO, I was told that a man who died at home on Sunday was showing symptoms of COVID-19, but he wasn't confirmed to have the virus. So my question is a test done after death to determine what the person died from, if they did in fact have COVID-19? And if not, are cases like those considered to be a COVID-19 death and added to the official figures? Just some clarity on how those kinds of cases are treated with. Also, I wanted an update on the Cuban nurses and where they are deployed in the health system at this time. Thanks.
Okay, so in terms of the tests, persons dying at home, over the years we would have had many individuals who would have passed away at home for many reasons, many causes. So I think Dr. Hines would have put up a graph that showed all-cause mortality on Monday, I believe it was. So what we do in terms of specifically answering your question, if someone dies at home, we, in the first instance, of course, a district medical officer will have to visit the body. There would have to be review of their medical records to see basically if they would have had any underlying issue, if they would have had flu-like illness within the last couple of weeks. So they would basically try, the district medical officer as well as their normal attending physician would try to ascertain a cause of death as best as they can. If they think it may be flu-like in nature, we can do a post-mortem swabbing to see if the patient is negative or positive at that point in time. And as you know, the Forensic Sciences Center has been swabbing every person that has come into their agency since the early part of the first quarter. So that continues. We can get a positive in an individual that has passed away, but we only add a death to the listing that we have if they actually have a positive test for COVID-19 upon presentation. We can put it as a suspect into our records if it's highly suspicious, or if they have been recent contact even in the household with a COVID positive patient.
Okay, on the question of the ICU nurses that came in from Cuba a few months ago, so I think the number was 11, if memory serves me right. They were assigned to the 5 RHAs, Tobago, and the 4 in Trinidad and Tobago. I can't remember the exact numbers, but I think 2 went to Tobago, 2 or 3 went to Southwest, and so on. So they were 11, but assigned to the 5 RHAs across Trinidad and Tobago.
Thank you very much. And now CL Communications, we're ready to take your questions, please.
Are you hearing me?
Yes, loud and clear.
Okay, so I have just 2 small questions. The Centers for Disease Control has deemed St. Kitts and Nevis as a low-risk country for COVID. Is Trinidad going to be looking at that model to see what they got correct and to see if we can implement some of those measures?
Okay.
And then secondly, of all the issues which have been raised as a result of COVID in this country, which issue is most challenging for the ministry? Thank you.
So I will take part of the first one and all of the second one. We have said, and I just mentioned it in my opening statement, the objective of Trinidad and Tobago now is to move from community spread to cluster spread. We have instituted all the public health measures. We are a fairly open society at this point in time. People are moving. The government has done a lot. But you would have heard Dr. Alana Best say this morning, and I took some notes here. One ill person went to work, infected 45. One elderly person had some sort of function, invited 12. You would have heard Dr. Hines talk about this issue of people still inviting people into their homes. Now, I know the question is always, what is the government doing? But we never ask the population, are you responding in like manner to help us? You've heard Dr. Alana Best say this morning, you are still getting reports of people inviting people into their homes knowing that they have a COVID positive person there in quarantine. These are the things that will not help us progress from community spread back to cluster spread, so we could be listed more favorably by either WHO or CDC. On the issue of challenges facing us, yes, we have two major challenges which we have been working on and rectifying over the past couple of weeks as this global pandemic bites us more and more. One is logistics and supply chain management, and two is communications. And we have, I think one question was raised here last week about communications with patients at Couva, and I admitted it freely. I was not happy with the way we were communicating with patients and their families in Couva, and we rectified that. How did we do it? We simply assigned a couple customer liaisons to call the families, especially of those in ICU and HDU who can't make phone calls, to update the families as to their status. So we are redoing our whole supply chain management plan, and we have started to redo and paying positive dividends already our total communications plan. You would have heard Dr. Alana Best speak this morning about her communications plans up at ERHA. This was as a result of our own in-depth audit of where we can improve. Thank you very much.
Thank you, and I think CMO, you had something to add?
No, I mean, just in regard to your question with St. Kitts, I mean, St. Kitts has applied all the measures that Trinidad has applied. From the get-go, you know, Trinidad went through all the phases that WHO would have assigned. We went from a phase where we had sporadic cases, then we went to no cases, went back to sporadic cases, then to clustered, and now to community. So the public health measures, as Minister would have said, are in force. We really are calling on the population to heed the cry, as Dr. Best would have indicated as well, to make sure that we align ourselves and we follow the public health measures as best as we can. And especially at this case, this phase when we have a lot of people at home in quarantine, the CMOHs are trying their best to continue the contact tracing twice a day, but we are relying on everyone to play their part to ensure that we decrease the spread of this disease so that we can return to cluster and hopefully one day return to sporadic cases.
Let me just add my 2 cents worth on here. You know, sometimes what is lost in this and all these metrics and comparisons of country to country is that sometimes we lose sight of culture. Let's say the culture of Japan, South Korea. They don't have to pass a law here to tell people to wear masks. All the Prime Minister of Japan has to do, or South Korea, is say, or Singapore, let's wear masks. And you know what? Because of their culture, every single person will wear a mask. But in Trinidad, we have to pass a law. We have a culture in Trinidad of being happy-go-lucky, partying. That's our culture. But we can't pass a law against that. So we will look at all the metrics, but we cannot discount the role of culture in all of this. And I give you examples of South Korea, Japan, and so on, where mask wearing is not really enforceable by law. They just do it because it's the right thing to do. But in Trinidad and Tobago, we actually have to pass a law for it and charge people $1,000. So we can't discount the cultural differences that make people behave in one setting as opposed to the Trinidad and Tobago setting or the US setting. In the US setting, you are seeing campus parties because that's their culture. It's their culture to have these frat parties and so on. In the United Kingdom, my daughter is there. And you get the reports coming out of England about partying and the pub scene and so on. So let's not discount culture in all of this. Thank you very much.
Now we go to I-95.5.
Good morning to you, Candice, and to everyone there. Whitfield to
morning, Whitfield.
95.5 FM. CMO, I don't know if you have these figures with you, but do we know how many of the 3,000 plus persons who would have contracted COVID, how many of them actually have comorbidities, and how many of them would have survived versus those who would have died? And secondly, the number of persons with comorbidities, is it spread across a wide number of age groups, or is it concentrated in the 58 plus age group? Thank you.
Okay. Right. So aside from the 3,293 cases we had 57 deaths, as you know. And when we reported on our active cases, all of those persons so far are doing fairly well. In terms, a lot of, I would say 80 to 90% of the people in the home quarantine, home isolation setting are doing very well, so much so that most of them are asymptomatic now, having no symptoms, having recovered from the illness. From tomorrow's press release, we should be adding a column that says community discharges, which we don't have at this point. So we have step down and we have hospital discharges so far. I have asked the CMOHs to put together a list of discharges. As you know, based on the criteria I discussed, we are actually coming up to that 20-day period now. So we will see a great number of discharges from the homes that we have positive individuals in the next coming days, over the next week or so. So we will be adding that from tomorrow morning to the figures, so you'll see a larger number of discharges coming up. But a high proportion of persons have recovered and are doing very well from the illness. A lot of them, probably in the region of 80-85%, have mild symptoms and are recovering while at home. So we are seeing some good signs in terms of the way the virus is behaving in the country. With regards to the comorbidities, I don't have the figure out of the 3,293 at this point. Persons that have comorbidity, we would have noted that our age group ranging from 25 to 59 bore the most significant burden during the past phase 2 of this virus. But the comorbidities related to death have occurred in the older age group, more than 80 to 85% of the cases. All right, so we can provide that breakdown at a later time, if you wish.
Let me just come in here again, because a very important issue was raised. I said just now that communications was one of the things we're improving. Mm-hmm. We are not doing badly, but we are not communicating that. What grabs attention is the mortality figures. But as the CMO just said, over 80% of people are doing well. But that figure does not grab the population's attention. We tend to focus on mortality. We tend to focus on the bad news, on the morbid news. And I have charged us at the ministry not to downplay the bad news, but to balance the news coming out of the ministry. I blame the ministry for this, because we have not been communicating what has been going right. So you will start to see that change very, very soon. Thank you very much.
Thank you. And now TV6, please.
Hi, good morning, everyone. There's a discussion right now concerning the procedure of a COVID patient after a COVID patient dies, in terms of closure for the family and how the body is prepared, as in terms of safety protocols. Could there be could the panel, anyone in the panel, please just shed some light on what is happening and what is being done about the procedure after a patient dies and closure for the family?
Yeah, sure. So there's a document that would have been sent to the funeral agencies as well as the RHAs since March. It is a guideline for funeral agencies as well as clinicians as to how to treat the body of the deceased. So basically, in terms of viewing the body, we have gotten a number of complaints from relatives that they weren't being allowed to view the body. I would have spoken to the president of the Funeral Homes Agency, Mr. Belgrove, yesterday regarding it, as well as the CEOs are aware of the matter. It is well within the guidelines that a relative of a COVID-19 patient who has died can view the body. there are personal protective equipment and infection prevention control measures that need to be put in place when that is being done to prevent any infection from transmitting from the body to any other individual. So that can be done as within the remit of the funeral agencies that handle the COVID-19 positive patients. So that process is available to the persons who have deceased persons. So it is something that is not forbidden by the guideline at all. Persons can view the body, but there's a special way in which the body is to be viewed to prevent any infection from being spread.
Okay, thank you, CMO. And now, is that the only question? Just want to make sure. TV6, you just had one question, yes? Just unmute your mic. I think we're not hearing you.
So I know the Minister of Health made a statement concerning young persons being the driving force behind the spread of COVID-19. I know Dr. Hines is not here this morning, but has contact tracing proved that that this second wave is partially or mainly due to young persons' inability to follow guidelines and follow the regulations?
Yeah, so thank you. So I said it was one of the driving forces. I didn't say it was the driving force. Yes, Dr. Hines gave us the evidence that contact tracing has revealed that young persons, and he quoted the age group, I think between 25 to 49, were in fact one of the drivers, not the driver. I was very careful. So it was one of the drivers for this second wave. And we not only see it in Trinidad and Tobago, Nicholas, we see it around the world. Because we understand that young persons are being placed under a lot of pressure to give up their lifestyle. They want to date. They want to party. It's what young people do. We understand that. We are not immune to that fact. And as Father Jason Gordon said, sorry to use his name so often, but again, he put himself out there. This is a time that calls for restraint. On all of us. All I do is work and go home. That's all I do. A treat for me is going to buy doubles on an evening. That is an outing for me. Or going to buy a gyros in Kirab Junction. That's an outing for me now. It's work, home, and find solace in home. That is what we all have to do. We have to really, at this point in time, depress our natural instincts as social creatures to be social. Whether it's going out or underground party, or inviting people into your homes to have a little drink up or whatever. This COVID-19 is going to put different stresses on different parts of society. It puts a financial burden on the business sector. It puts a religious burden on places of worship that you can't worship as you are accustomed to. It places a social burden on young persons. We understand that. But for us to have a brighter tomorrow, we must invest in attitude change today. So, Nicholas, I really want to thank you for raising that issue with me.
Thank you. And now TTT News, please.
Hi, good morning, everyone. Sanon Lala, TTT News. Minister Diyal Singh, I'm reading an article in a daily newspaper which is saying that several persons, after suffering a heart attack or some other instances, they were designated to take a COVID-19 test before being treated. Can you confirm this is happening?
So that is under the remit of the Chief Medical Officer, and he will answer you.
So yes, we have noted not only for heart attacks, there have been some private institutions as well that are requiring from the start, from I would say February or March, persons that are visiting their institutions, even for pregnancy-related matters, to have a COVID-19 test before you come in to the institution. And it's really they are putting measures in place which they see important to prevent the spread within their institutions. Just as we have put a parallel system in place, those institutions are putting checks and balances by way of COVID-19 to prevent infection in their institutions. So again, it has been happening throughout the country, A lot of times in the private sector, it has been happening that persons really require a COVID-19 test before they are seen for other illnesses. But from the public sector point of view, we try to put other measures in place for those that do not present signs and symptoms of COVID-19. So we have different metrics by which we view and try to go into our parallel system. But we have communicated with the private sector to see how best we can streamline their process so that we don't avoid untimely morbidity from those policies.
Okay, thank you very much, CMO. And our final questions this morning from Newsday. And we seem to have lost Newsday. Unfortunately, we'll have to take his questions off air. And we've come to the end of this morning's press conference. Everyone, thank you very much for your participation. Please remember, this is not business as usual. This is the new normal. Every day we encourage you to be safe and wear your mask.
Every day, I carry two things with me everywhere I go. Hand sanitizer, so that I can keep my hands clean, and a mask